Hello, everybody. Good afternoon. It is so wonderful to see you here today. My name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute. And I would like to welcome you to the final session of the 2025 Bring It Learning Series, Navigating AI, Exploring Opportunities, Challenges, and Policy Development. So just a little bit about KHI. We are a nonprofit, nonpartisan educational organization based in Topeka, and we were established in 1995 with a multi-year grant from the Kansas Health Foundation. We're guided by the vision that Kansas will become the healthiest place to live through evidence-based and innovative strategies, policies, and practices. We work towards this vision by providing nonpartisan information, convening crucial conversations, and facilitating learning that leads to meaningful change. So if you visit our website or you stop by our building, you'll see that our work involves research, evaluation, technical assistance, and policy analysis, as well as podcasts, blogs, and gatherings just like today's Bring It session. So the Bring It Learning series is offered by KHI, and it's really a chance for all of us to come together for sessions about health policy topics related to issues that may be considered during this year's legislative session in Kansas. And we call these sessions Bring It's because it's an opportunity to connect over the lunch hour where you can bring your lunch, your questions, and your perspectives on the topic at hand. So now I'll give a brief overview of the agenda for today's session. We're really excited to be having a really dynamic panel discussion. And so after I wrap up opening remarks, we'll be engaging in that panel discussion with three awesome panelists who bring a wealth of experience and expertise to this field. And then after the panel discussion, KHI experts will provide an overview to two important sections of the AI template and guidance resource. So today you will hear from three wonderful presenters, and it is my pleasure to introduce my colleagues here at KHI, Tatiana Lin, who's a Director of Business Strategy and Innovation, Emma Urich, who's an analyst, and Shelby Rao, who's also an analyst. Tatiana, Emma, and Shelby all work together on the AI template and guidance along with partner organizations. And now I will pass it over to Tatiana, who will moderate today's panel discussion.
So much, Rebecca. As Rebecca mentioned, my name is Tatiana Lin, and I'm Director of Business Strategy and Innovation at the KHI. I am very excited to have a dialogue with our great panelists today, and we will talk about many different topics, including opportunities and applications of AI in public health and emergency preparedness and county government. We'll talk about challenges, some solutions, and some advice from our speakers. And so what I would like to kick things off is with brief introductions of our panel. We would love our panelists to share your name, your organization, and since our discussion today focuses on AI, if you can mention how AI intersects with your work. With that, let's start with Kate.
Great. Thank you so much, Tatiana. It's really wonderful to be here. My name is Kate Garman-Burns. I am Executive Director of MetroLab Network. We are a nonprofit in Washington, D.C. that aims to change the relationship between cities, counties, and research and science. And we do that often by partnerships with universities. I am a proud Kansan myself and Jayhawk alum. I formerly worked for the mayor of Kansas City, Missouri for Mayor James, and then worked for the mayor of Seattle, Washington, Mayor Jenny Durkin, as their technology policy advisor. So I formerly have worked on data governance and surveillance issues, transportation innovation, and at MetroLab Network have continued that work to create a AI task force focusing on policy guidance for local governments. And so here to talk about lessons learned and some key things, and happy to be here. Thanks so much, Tatiana.
So much, Kate. And Jamie, look forward to hearing from you.
Hi, everyone. I'm Jamie Pina. I'm a biomedical and public health informatician, and I work at RTI International, where I'm the senior director of a center called the Center for Data Modernization Solutions. I've been working in the field of public health informatics for about 25 years, and my focus is generally on the integration of emerging technologies into public health practice and also helping to develop the data modernization landscape nationally. The team that I work with at RTI International does a whole bunch of AI-related work. We focus on custom tooling to integrate artificial intelligence into certain data sets and projects. And we also do work on regulatory and policy issues related to AI. I'm really excited to meet with the panelists and you, Tatiana, today, and look forward to the discussion.
Cool. Thank you, Jamie. And Justin.
Hi, everyone. My name is Justin Snair. I'm the CEO and founder of Preppr.ai. Preppr is an AI-driven platform that's aiming to disrupt the status quo in disaster preparedness by making tools that are affordable, accessible, and high quality for local and state government. I have about 20 years of experience across government, military, emergency management, and public health, and I'm at this intersection of building solutions for public health entities. And so I have a hyper focus on how it can be done responsibly in the context of disasters and preparedness. Thanks for having me.
Wonderful. Well, very excited with all the expertise that our panelists bring to the table. Would like to start with setting the stage on talking about the definition of AI. As we all know, AI is a broad concept, and there's no single universally accepted definition. Would love to hear from each one of you, starting with Kate. What is your favorite definition of AI and why it resonates with you?
Well, that's a good question. I saw one the other day that actually had in the definition itself that it makes predictions. And I joked that no lawyer would write that definition, that AI makes predictions. So, I think there's a lot of good ones out there. I think the one important aspect that I will add to is when we were thinking about policy guidance around AI, we got into this fuzzy area of GenAI versus other AI large language models. And I think the reason that's important to talk about or distinguish is because GenAI can really be done by an individual on an individual's choosing versus, a large organizational approach with AI is very different. If a nonprofit, health institute, university is using it on behalf of the organization, that really changes the game in terms of responsibility of use, who has access to it. So I think from my perspective, I think that's the more important piece. So ultimately, in our policy guidance, we deferred to AI generally, and then when specifically it referred to GenAI, we called that out. So that was our lesson learned.
Thanks, Kate, for distinction between this AI and GenAI and also the prediction part of the definition. And Jamie, what have you seen in the field of definition of AIs?
Yeah, thanks, Tatiana. As I read that question that you shared with us, I jotted down a definition just kind of off the top of my head, and I realized it's the one that I say often when people ask me this question. I've had to teach this in a lot of capacities. So here's what I wrote. I said, AI is the science of teaching machines to mimic human thinking and decision-making so they can recognize patterns, solve problems, and make estimations, often faster and at a larger scale than humans can. And I like that the general messages there are that, while the development of artificially intelligent agents and tooling can be very complicated, the practical use of it doesn't have to be complicated, right? We see people every day now using GenAI and other tools for various things that are not, necessarily highly complex, even if in the background they are. And I think it's also important in current state, given that we have generative AI available to everybody now, to highlight the practical value of what these tools can do. So, when I first was introduced to AI broadly, it was in the context of computer science study and learning how to code and create machine learning like from scratch. But most people don't need to do that. And so I feel like focusing on practical value and application nowadays is like a good part of a definition.
Thank you, Jamie.
Yeah.
And Justin, what is AI to you from your perspective?
Can I be different and say what AI isn't at this point?
Absolutely.
It's not entirely new. It's been around in some capacity, conceptually or in our everyday lives for 50 years or so. It's running everything from spam filters to text messages to just a whole host of stuff you're interacting with every single day. So it's unavoidable. But like the other two panelists have said, that lately it's getting more attention because generative AI, and it's doing something that we've felt has been very much a human skill set. It's generating words, generating sounds, generating images. It's doing things that are very human-like, and now it feels a little like magic. And it's important to know that this generative technology is it's not perfect. It is a lot of cases just predicting the next word in a string of words. So word generator, it's a bunch of math. It doesn't reason like we do. It doesn't think like we do. But as Jamie said, there's a lot of benefits still to what it can do when it's used and applied in safe ways and to solve practical problems. So, but a lot of people expect AI to be perfect when humans aren't perfect. So let's just not, in my position, let's be clear that it's not perfect and try and be no worse than humans at the job, at the very least. So, but it's certainly not new, and policy saying don't use AI is a little bit like cutting off our legs at this point because it's everywhere. So thanks.
Wonderful. I think all of you touched on some, I heard some common themes about really helping with some complex tasks, about helping with predictions. We heard about that, AI cannot expect maybe to be perfect. And so thinking about that, but what I heard is really common theme from each one of you, that there's potential in application AI to different areas. So Jamie, from your perspective, working in public health, can you share some examples of successful AI application?
Yes, absolutely. And it's really interesting because, the recent tooling that we now have for accessing artificial intelligence has become, readily available to a very broad, population of people very quickly. And I feel like we're all still kind of sorting out what the best use cases are within different fields. In public health, there are already some good examples of use, and it's pretty exciting to see. And I think it comes with some caveats and concerns that we have to monitor and talk about, as I think you all know. So the first and most promising use, I think, is predictive analytics for disease surveillance, right? Machine learning and AI is very, very good at identifying anomalies within large data sets. And that's something that can be applied to public health data. And we can identify more unique anomalies and patterns than we ever could before. You see that happening at CDC, at the Centers for the Center for Advanced Analytics, or the Center for Forecasting and Analytics, rather. And you see it, I think, in a growing way at state and local health departments as well. Another thing that public health does with artificial intelligence is streamline its workflows for administrative work. So, generative AI is very good at taking like a whole bunch of text and sorting it, organizing it, chunking it out into different pieces and things like that. And finally, developing drafts of health communication and health intervention messaging is something that we see public health doing quite a lot. And it's a really fantastic use of these tools because, it's time consuming and there's a lot of cognitive burden for people associated with writing a message in 10 different ways so that it resonates with like 10 different audiences. And using like the nomenclature and verbiage of a particular population that you're trying to get a public health message to is something that I see LLMs being very good at. Of course, all of this is with the caveat that a human needs to be guiding that usage and intervening and editing as necessary. But those are three key uses, and there are lots more, but I'll pause here. Thanks, Tatiana.
Thanks, Jamie. I really appreciate you bringing some perspective about how multidimensional use could be, ranging from data application to communication and public health, and of course, bringing that important notion of human oversight, which is very important. And so, kind of building on that discussion, Justin, I know you have explored of using AI applications for emergency preparedness. Can you talk a little bit more about what are some effective use cases or potential for using that in that space?
Sure. So I hear a lot from emergency managers that they would like AI to predict the next disaster, like almost all the time. That's what they're looking for. And I started at a different end of it, using AI to generate exercises and scenarios and things like that, where to me, that's where it's the safest to be wrong right now. It's designing games, not in response. You're able to take time. You're not under duress. But a lot of folks want to start, they almost always say predictive analytics for disasters. They want to see resource allocation decision making and streamline and personalized communications during responses. And that all scares the heck out of me. And I work in this every single day, all day. So I'm trying to guide people towards the most appropriate use where the technology is. And so it should be relatively low risk for me in public health and preparedness. It should be not where there's a bunch of decision making that's under urgency, and it should absolutely have people involved in it. Later, maybe we can, there'll be a whole host of data generated from over the next decade, and humans could actually make the AI decision making worse. And then we have to have a really uncomfortable conversation around should we exit as the human in the loop? But we're not there yet. And I think people are looking for a lot of emergency management is skipped, I think, some basic automations and technology adoption over the past couple decades, and now they're reeling from it and they're reaching for the new shiny thing, AI, and they expect it to be perfect. I think it's a mistake. A lot of them just need basic automation and digitization. And I usually advise them don't reach for AI if you haven't considered the non-AI solutions. And some of it's just bad processes. So AI will make bad processes just infinitely worse. It'll scale it at the speed of AI. So, but there's other cool things I think in emergency management we're really focused on is, Jamie said about customizing to like public health messaging to like 10 segments. I want to take that even further and say, well, how do you make it hyper personalized to the individual? And so you meet them where they're at within the context of the message that's been approved by a human. So maybe my generation, I like a paragraph. Maybe a younger generation wants, a video made for them. And it's that hyper personalization by preference that we're really focused on, that I'm really excited about. But also where it intersects with data. So we have some emerging projects for like nail salon workers who are wearing sensors around what their exposures are, but they don't open windows when they're supposed to let fresh air in. And we're looking at how do you take sensor data, intersect it with communication tools and hyper personalization to say, go open the window, because in your language of preference, in your dialect of preference, in your format of preference. So it's that hyper personalization, I think, that it's gonna be really exciting.
Justin, thank you so much for kind of unpacking that opportunities in emergency preparedness for us, and also highlighting the importance of have a clear rationale why and when using AI. And so with that clear rationale, Kate, I have a question for you about, as you were working on the AI task force and convened counties across the nation to do so, what have you observed? What was your lessons learned? And also, why did you, in the first place, did you put this AI task force together?
Good question. Probably because a equal dose of crazy, but necessary. When we did, which was, we were one of the first in the summer of 2023. So the year, right in June 2023, Metro Lab announced the publication of a data governance policy guide for local governments. This had been the culmination of 3 years of work, bringing together 25 unique cities or counties and 7 universities to produce 48 pages of model language for data governance for cities and counties. It is still to this day the most robust available policy guidance for cities and counties to think about data. We're really proud of it. And so the next line of work was thinking about AI. As ChatGPT had really just become publicly available 2 months prior to that. And we knew that some basic processes were going to be challenged, like what, as local governments deal with public disclosure laws, what of that was disclosable, what in labor agreements was on the table, how could we unlock really complicated processes, how could we access grants better. For example, I was just at the NACO convening National Association of Counties. There are some counties that have not been reimbursed by FEMA for disasters since 2008, that happened in 2008. And so, how can we streamline some of those things while balancing the governance piece? So I think it's important for local governments because they are both a potential regulator and consumer of this technology. Some really other quick bullet points as to why it's particularly hard. One is all levels of government learn what it was like to be a city who got scooters put on their sidewalks without warning. Suddenly there is a technology in the consumer's hands without warning, and that changes the dynamic already. Second, it's not defined at which jurisdiction should regulate what. The feds, the states, and cities and counties are all thinking that they need to do something. That also makes it a little complicated. And the third is that it's really hard because, for example, as a local government, I do not need to know how a combustion engine works to create good parking policy. But with AI, I have to have some degree of knowledge on how it works to both use it and to regulate it. And when you're talking with people who are already strapped for capacity, that's somewhat difficult. And so I think supporting folks in every industry to understand what AI is and how it works, how to use it safely, and then how to use it with impact is really key. We also learned a lot of initiatives started as we were going as well. And so there's a lot of guidance available, which is helpful, but how to make it most impactful is the issue of today.
Great. If you were talking about these topics, I noted that each of you mentioned some kind of capacity building aspect to AI as well as a rationale. So I'll be curious to hear what can this capacity building look like for public health professionals, but also professionals in other fields? What are some do and don'ts? So maybe you can give me 2 quick do's and maybe 1 don't in that space. And I'll start with you, Jamie.
Sure, I'll give that a shot. I mean, in terms of do's, I think the first is well, I'm going to start with the don't. Don't upload sensitive data to a web-based version of an LLM that you have no control over and cannot monitor the security of. I think with public health data in particular, there could be a security risk with trying to organize or manage data that's protected under local and federal law, and trying to manipulate it quickly using generative AI or some other AI-based service. In terms of dues, I think, have a policy at each level of organizational structure within the public health environment. Make sure that there's something in place for employees to reference so they know that the use that they're applying is allowed and it may be even supported. And there have been state and large municipal public health agencies that do that. They have a statement about what's allowed currently, what the current thinking is about the available tools and how they should be used in public health practice. I think the next do is to ensure that staff are trained in the possibilities and the potential that generative and other forms of AI provide to public health. We talk often in the public health field about how we are under-resourced and how there's a lot of pressure to do a lot of things with a small number of people. And I think generative AI has the capacity to be a multiplier for the amount of output that can be created with a small public health workforce at each level of the organization. And for that reason alone, it's really important that people in the public health workforce understand the technology that's available, not necessarily how it works in the back end, but what kinds of outputs it can produce and how trustworthy those outputs are and how they use them in their work. Thanks.
Thanks, Jamie. I think great suggestions for capacity building and how to really balance some active, training and opportunity to increase knowledge with providing some resources. Justin, what are your thoughts? What are some other ways we can build capacity? What are some do and don'ts from your perspective?
I'm gonna riff on Jamie's for a minute. Don't write AI policy and only involve your IT people. This intersects with people, policies, practices, feelings of value and your community. And I work with a bunch of national public health nonprofits who are developing AI policy use, and it's mostly done by their IT directors. I think it's a big mistake, and a lot of it's so don't do that. Be inclusive. And so do include community, do include employees, do include a bunch of sometimes uncomfortable conversations around what do we value, what should be persistently human driven, and go through all of that kind of the mucky part before you start writing things down into a technology policy. And so that's a do and a don't. Do start every process with an assessment down to the individual staff person and leadership with your understanding and literacy with AI. It's really hard to have a conversation about how to use AI or how to regulate it without first understanding what's your basic literacy. People are making a ton of assumptions and they jump straight to use or policy, and they haven't even determined, do they have even the vocabulary to talk about it. Don't trust every single vendor that comes in and says, I'm a vendor. Don't trust every vendor that says it's going to solve every single problem you've ever had, particularly emerging ones. And do ask, what happens when your business belly flops in 12 months because you're a startup using AI? What happens to my data? So it's just a lot of, I do have a ton of curiosity, I think, in this. So I think that was 3 do's and 2 don'ts, but
That's awesome. Thank you, Justin. A quick follow-up question on questions to ask. You mentioned, be curious and ask questions. Is there a couple, 1 or 2 questions that as organizations are thinking about as they looking at the AI tools or looking at other AI solutions, what questions should they ask when they're procuring AI tools?
It really does need to start with like a very orderly self-assessment. Like, do we have the internal capacity to screen or talk with these vendors that are going to be talking fast about solutions? Like and it's not, yeah, I've used ChatGPT. I think I get it. Like, we need some real tools for like assessing non-technical folks' capacity to have these conversations. And then being honest, if you don't, getting the right folks in the room to help you even start this process. So even talking to vendors is too far in the process. It start with, does our organization have the capacity to have these conversations and a solid self-reflection, and one not filled with ego and saying like, oh, I'm IT, I've been in this for 30 years. Like, there's a lot of angles to this. And so that's why I'm kind of hard on IT directors, because they jump in and they start saying, I got it. But like, we need an orderly conversation. So that's really where I would start, is a self-assessment leading to an organizational assessment.
Justin, appreciate it. And so now I would like Kate, to have a question for you. That you talked about policy and the importance of AI policy. We were able to post the link to the guide that you have mentioned from MetroLab in the chat. And so, so thinking about that as AI as a potential solution, or at least a part of the solution to help with capacity building, from your perspective, what's the ways to craft the policy in a way that is effective and also mitigate some potential, risks of creating a policy?
Yeah, it's a great question. I mean, I think the individuals within your organization are always going to want to know, like, what can and cannot do. I also think providing training for individuals is good. Some question, Tatiana, like, I think some do's are have disclaimers of when you're using it as an organization or your employees are. Fact check hallucinations, which is when AI produces an inaccurate result, is a concern for people everywhere. It's still not perfect. There are ways that AI can flag when there are conflicting inputs of data. So if, for example, there's a application to apply for a grant and the income threshold is $55,000 somewhere, but then it's $60,000 somewhere else, it flags that there's 2 different numbers. So I think, we want to work on making sure it's accurate and having a human check on that. But importantly, I think it's also making sure that whatever you're doing with AI has that social context. There's a lot of discussion, for example, about definitions to me, like the word safe and how I think of safety in my world versus someone else thinks of safe and safety in there. And so what we've seen across local governments who have produced AI policies so far are these areas: fact checking, making sure that there's, if there's any inputs that are biased, making sure that you're complying with other employee requirements, whether you're in a public organization and doing disclosure, whether or not you're unionized, things like that. And then, making sure that it's known to the degree of which you're using AI to produce something.
Kate, and as you were talking about that, I'm going to probably do a shameless plug for the resource that Kansas Health Institute with partnered
Yes,
Health Resources and Actions in Wichita State University with a public health infrastructure grant was able to produce. And we also really appreciate actually Jamie, Justin, and Kate's team from Metro Lab contributed as reviewers to this guide. It does provide some additional information on what type of provisions could be included in each of the sections and some of the considerations specifically from the public health perspective. And so that would be, if you're curious to learn more, there will be a link in the chat. And so thank you so much for all of you to providing some, or starting our conversation on some considerations and concerns around AI. Before I jump to that question, I would like to pause and see if there are any questions from our audience. I see one that just came, and so I'm going to go ahead and ask that questions. There's a question about how, thinking about different cultures and cultural sensitivity, how AI works with cultural sensitivities, what might be appropriate in the United States might not be appropriate in Europe. So how to deal with that through policy or other solutions. So if anyone, any panel want to take that question? Justin, okay, go for it.
I can only speak to it just because we've been dealing with it and designing that nail salon chatbot where there was a really big interest initially to make it multilingual but to use open source or US based or Western based models where it may not have sufficient quality with Mandarin or other languages. So we had to make choices of limiting representation because I couldn't control for quality and couldn't control for dialects and cultural sensitivity. So model selection matters for some of these generative tools. And we had this very discussion around how do we assure that it's maintaining cultural sensitivities to a variety of folks that are in the nail salon looking for advice. I think at this point, I advise them to just disclaim like that this is imperfect. It's based on core messaging, but at times it's not going to be perfect. And don't pretend it's a human on the other end. And just say this is generating it, trying to adapt it to make it accessible, but it won't be perfect. And so I think it'll get better over time, but even purporting to be able to, to speak in Spanish, there's many, many different dialects, and that's going to take someone out of the experience. And the predominant one may be one dialect over another. And so we're working on personalization mechanisms, but even giving a sample of someone speaking and then modeling that as a way. But just, I think full disclosure where it's not perfect is a good way to start right now. So.
Thanks, Justin. And Jamie?
Firstly, I agree with Justin very much that disclosure about the likelihood that the content that's generated will be appropriate for all audiences is probably not true. I think that's a really important caveat. So some generative AI models will allow for local tuning, and I think for whatever happens at the development and like training part of the LLM is sort of out of the user's control. What you can control is your prompt. And, if you're a public health, practitioner sitting at your desk using generative AI for some specific purpose, and you need it to be relevant to a US-based audience or maybe even a more narrow geographic region, you can prompt the LLM with statements like, respond in the dialect of a group X, or, respond considering a model trained in the US only, or something like that. So the user has a little bit of control there. As far as the larger LLMs that we all have access to through the web, they're generally trained on global data. But I think you can narrow your region or your area of interest through prompt engineering.
Jamie, and yes, prompt engineering is definitely one potential solution. We have expanded on that as well in this guidance that I have mentioned and provided some kind of, here's how you can do it, but here's how you can enhance prompt. So at least that's something that we can try and be conscious about how we asking questions. And Kate, I want to flag something that you posted in the chat. You mentioned that the general data protection regulation in Europe have impacted individuals' experiences with data privacy and data being used. If there is anything else that you would like to kind of expand on that, how that can address the issue of cultural sensitivity?
Yeah, I think two other ones, and I don't know if it's to the individual culture, but one is like with cybersecurity, there's a lot of concern about GenAI doing a really good job at pretending to be something it isn't for cybersecurity purposes. And I'm curious about how phishing and other things that are now more at people's fingertips because it's easier to produce would happen in other cultures. And the other thing is we'll see what happens with the federal government and with standards. Like NIST was working on a bunch of standards under the Biden EO, and now that has been rescinded. And so I am curious as to how the EU and other places will provide standards. A lot of this technology is coming from private companies. It's not publicly, like, we don't see under the hood. And so I think both in terms of how we can start putting standards around bias, accuracies, safety, things like that will be something else to watch.
Kate. I would like to see if there are any other questions from our audience to the speakers. Don't see any in the chat on the Q&A yet. And also feel free to unmute yourself and ask a question. I'll just give a couple seconds for that. All right. Well, while you're thinking about the questions, feel to add, we will probably have another 5 minutes before we end the panel and transition to the rest of our program. So if you want to maximize the time and opportunity, please do so. But we talked quite a bit about some potential challenges and with AI, and specifically you all mentioned bias mitigation, the need for human oversight, data privacy, and data security. So thinking about some of those considerations and concerns, in addition to having those standards that Kate mentioned, are there any other particular strategies or best practices that organizations can implement in order to address those concerns? Oh, for Justin.
I had something I wanted to say, and I'm going to wedge it into this question, but I think it's relevant. So one of the things that we're working on right now, like we've built generative technology that's going to impact public health preparedness. It does it pretty well. And what we're really interested now is like, how does the public health agency be more inclusive through that technology, where it's inviting others outside of their agency to participate in something that's generative and then shared data. And what we're realizing that, this gets into like governance and how do you set up the systems of control down to like the individual groups that they're not in your organization. So this is like your policy intersecting with someone who doesn't have a policy potentially. And so what we're finding is through talks with potential health departments is, them being able to set up administratively what's possible for sharing data. And then the folks they're bringing in can accept that. And it's not dissimilar from other platforms right now, but having sovereignty down to the individual to configure what they share. We're finding that to be really interesting because we're automating the sharing, intelligent sharing across different groups in the network. And really it gets down to that individual entity, that node participating. They want to configure what they share back. It's not just about having the potential to do it. They want granular control over sharing the content they're generating. And so that was new to me. I thought, give them permission, build it, they'll come. And it's actually build it, make it available, but we want to control down to like potential like blocks of content, and then automate it and everything. So it's been interesting to see what happens when you build as a swarm with it, generative AI. So that's policies intersecting with other policies in a community to replicate something public health is supposed to be doing, is intersecting with the community. So what happens when your AI thing intersects with others and you've delegated access to other groups as part of your tool, and it opens up this whole new world of policy that I hadn't thought about when I drew the picture for swarm design. So, but I'm not sure if that answered, but that's what I wanted to say. So before we're done, so
that's great. Thank you so much, Justin. Oh, go ahead, Kate. And
yeah, just to add one other thing that I think, at least with local governments, there's two ways to really put this stuff into action, and that's by the power of the contract or the ordinance, and all of that has to deal with lawyers. And so if any of you work with lawyers, please tell them about webinars like this. Like the lawyer is going to design a lot of these controls. And so making sure they feel empowered and supported and brought into the conversation is just a really good place to start.
Thanks, Kate, for sharing that. So,
Any lawyers that do that, I would love to know, because it's not my regular lawyers, my general counsel. It's this other thing where they have to understand the technology. So I would love to. There's a list of these AI lawyers and policies that would be super helpful for me. Assuming others too. So.
so thanks for flagging that, Justin. If anybody knows of a lawyer that has AI background, please post their contact information in the chat. So I know we only have a couple minutes, so I would like to maybe wrap up this discussion with a question in the chat. That there's a question about potential loss of public trust and confidence in AI. And so what are your thoughts on that issue and how it can be addressed? And if you also want to just mention anything else on AI that you think it's important for our audience to know. Jamie?
Yeah, thanks. I think this is a great question because, when public health faces an emergent health issue, probably the most important thing is that we're delivering accurate messages quickly and that those messages resonate with the intended audiences that they're headed toward. So if we're using generative AI to develop those messages or to assess where the messages need to land, I think there's a few things we can do to help maintain trust and reliability. The very first one is something that Justin mentioned earlier, which is disclosures about the development of the outcome or the output. So these messages are developed in part with the assistance of generative AI is a good start, and I think there's other policies you can implement to sort of help bring that level of accountability forward. But to me, maybe even more important than that is that if a message that's tailored to the public is drafted or generated with a generative AI, it absolutely has to be reviewed by public health professionals and edited for accuracy before it is released. I don't think we're quite at the point yet where we can allow like a generative AI tool to independently draft a message and send it off to the public without any curation by public health professionals. So in contrast to that like challenge and the risk of losing trust, on the other hand, if we use generative AI in a meaningful way in those emergency contexts, we can get messages out way faster and tailor them to different audiences in a way that makes them easier to understand. And I think that's a tremendous benefit because for those of you that work in like health communications, tons of human energy goes into creating messages that are accurate and like tailored for specific populations.
Jamie, and I particularly bringing the oversight kind of component back to the importance of the AI discussion in the way that hopefully the public as well, if they use an AI, can also have that oversight as they look into the information it produces. Well, I know we have to wrap up the panel, but Kate, Jamie, and Justin, maybe one quick last thought as we wrap up the discussion. What do you think it's really important, one takeaway that you would like our audience to take with them today from all of this conversation? One particular takeaway. And Kate, if you want to start with
I'm happy to start. So I think Ezra Klein just made a statement yesterday that's something like, the story that journalists are missing is the advancements of AI and how it's going to change humanity forever. That sounds really loaded, but I think that's really interesting. But it is up to us to come up with the use cases, and it is, I think, up to the people to define in this moment in time what AI really looks like. I mean, the jetpack was invented in the 70s, and it didn't come to fruition because of the economy and people's choices. So, this is a really amazing technology, but I think it's awesome that everyone is here to learn about it, and I think we should all feel empowered to help shape it because it is the moment to do that.
Jamie?
Yeah, thank you. It's great to have this discussion with you all. Similar to what Kate described, generative AI is an incredibly transformative technology that's going to disrupt industry in ways that we can't even imagine now. And so I think probably the most important takeaway is for all of us is to be curious about what we can do to implement it in our own working environments and to have fun with it because it can do a lot of incredible things. And there'll be moments when you're trying out these tools where you will be astounded at how high quality some of the output can be. I'm still waiting, Kate, for my jetpack to arrive in the mail that I ordered in 1970. But generative AI is available now, and that's very exciting.
Jamie and Justin.
Yeah, so being so I'm in the private sector now. We made Preppr, this exercise design tool, in about 6 weeks, and it made things that looked like exercises. 6 weeks to do that. It's taken another 1,000 hours, 2,000 hours to go from it made words to be reliable words for that specific use case. Um, so if you start making solutions or you start looking at solutions, like it's really easy to make it generate the words that seem on the surface to fill your need. But it's been thousands of hours since then to make it reliable, scalable, usable by hundreds of users or thousands of users. So it's kind of what Jamie had said, like, how do you get that messaging, that thing it's producing to be reliable? Don't underestimate the amount of time what my devs call Justin refinement, where it's the most expensive part, because they could code it in 6 weeks. It's been me reading things and saying not quite right. For an industry that's narrow, broad public health application, like don't underestimate the amount of time the practitioner is going to have to look at those outputs to say not quite right, and then work with technologists and devs to make it better. Like, it's not going to be, here's my core message, now use it. It's going to take many, many, many hours to make it viable. So
Wonderful. Well, I learned so much from this conversation and dialogue, and I really would like to thank Jamie, Justin, and Kate for sharing their insights on this topic, and I hope there will be continued conversation. There's also one more question by Becca in the chat, so if any of the panelists would be open to answering that, that would be great as well. Please, the audience, don't leave us yet. It's not the end of the program. We still hope to have you for another 11 minutes because we're going to have additional exciting content presented by Emma and Shelby. So please stay with us. And again, Jamie, Kate, and Justin, thank you for your valuable time today. And with that, Emma, please take it away.
Thank you, Tatiana. It was such a great conversation, and we covered a breadth of topics relating to AI, but we're really curious about future learning opportunities. I know there's some ongoing chat about the legal landscape around AI. So if you could have your phone near you and take a picture of the QR code on your screen, we would love to hear your thoughts about what about AI are you still curious about? And if you were to attend future opportunities, what would you really like to learn more about? So just take a few seconds and scan that, and then we can present on some of the tools and resources that we dropped in chat earlier, specifically the AI templating guidance. So moving us along, so the AI templating guidance resource we dropped in chat earlier was informed by a lot of different research across the country, the literature, but specifically city and state policies. So this map is really looking at state legislation pertaining to AI. So we really wanted to understand the AI policy landscape and how states were approaching AI policy development. So we looked across several different legislation across the state, and we found that we found policies related to responsible use in the healthcare sector, education, oversight, elections, really a large swath of different topics. So the AI templating guidance was heavily informed by a lot of these policy provisions. And so kind of going back to our panel discussion, and Justin talked about kind of assessing organizational capacity and having these conversations about how to best use AI, and really just taking a self-reflection and assessment to see how AI is best suited to help an organization with various tasks and services. So KHI and partners developed the AI templating guidance to help facilitate this. So this resource has several activities that will help your organization think through AI responsibly and ethically, and also just going back to Kate's point about seizing the moment looks like having conversations. It looks like talking to your colleagues and discussing best use cases. So this guidance is really broken up with a lot of great information from literature and other practices. and policy examples that Shelby and I are going to go into, just two topic-specific sections that we included in this guidance related to data privacy, as well as training and capacity building. And we thank you so much, Justin and the team at MetroLab and Jamie's for serving as reviewers and helping make this guidance really applicable to public health. But you could also see several other reviewers on this list that really make the guidance multidisciplinary beyond public health. It's also applicable to nonprofits, local governments, et cetera. So we're really thankful for this group to help that helped develop this resource. And so we're seeing some thoughts trickle in for our word cloud. So in 1 to 3 words, some AI topics folks are still curious about is liability issues, looking at exactly how it works. I know kind of the back end algorithm and programming stuff is very complicated. It's difficult to know just how AI is making decisions and what data it's using. So that could be definitely a really great conversation for the future. Also the legal landscape, and also some work support for maybe transitioning and using AI tools. So in our event recap, we can post the results of this word cloud. So please keep your additions coming and we'll continue to look at that. Okay, so now we're going to dive into some topics, the 2 topic-specific sections of the templating guidance. If you attended a webinar we hosted several weeks ago, we looked at human oversight as well as bias mitigation. And today we're going to be looking at data privacy as well as building capacity for staff and training that could be helpful when using AI. So with data privacy is so important to consider in a policy, and it was definitely a prominent theme we identified in state legislation and also cities who were developing policies around AI. And for public health specifically, it's so important because public health organizations, health departments, state agencies, healthcare systems as well, they handle vast amounts of confidential health data, medical records, financial details. You also think about all the different qualitative research activities public health organizations do. So surveys, focus groups, interviews. So it's really important to kind of understand the ownership around this data and how it's being used and where it maybe shouldn't be inputted, or what generative AI tools may need to have some consideration for putting data or using GenAI to make maybe data visualizations around different use cases. Another thing is, Kate mentioned earlier that there isn't a universal US standard around disclosure for cybersecurity practices, but that also is the same for disclosure of data usage. And this is as of November 2024. There was previous mention of the Biden administration's EO on working towards standards specifically for cybersecurity. It's unknown if the current administration is going to be looking at disclosure of data use or other different aspects of AI use and safety or privacy. So it's really important to just consider how the standards that an organization wants to look to. And we can see that this is an evolving landscape that'll maybe emerge with more information later. So across the policies that we looked at with data privacy, the 3 key buckets we saw was really just how to handle sensitive and identifying information when using an AI system or procuring an AI system. Also just looking at best practice for security, as well as just reporting requirements and consultation to be compliant with HIPAA and other regulations around data privacy as well. So I'm not going to go over each provision, but this just gives you a flavor of some of the provisions we identified in state legislation and also in city policies that an organization can take and cater to their needs. So the first one I can just highlight just really is looking at prohibiting users from taking that sensitive data and protected information and not maybe using a generative AI tool to summarize findings, use a data visualization. I mean, there's several different applications. And if you want to look more closely, you can refer to the AI templating guidance. And so now I'm going to turn it over to Shelby Rao, my colleague, and she's going to give just a flavor of the training and capacity building section in these final minutes.
Well, thank you so much, Emma. I know I have 3 minutes, so we're going to rock and roll through these slides. So first, just understanding why training and capacity building is so important to include in your policy. I love the quote that Kate said during the panel today that you don't have to understand a combustion engine to have good transportation policy, but you do need to understand AI. And I think that really ties in to the conversation about training and capacity. It's crucially important when you're thinking about, making sure that your staff is comfortable and confident using AI. Otherwise, they won't use it or they won't use it properly. Additionally, having these trainings empowers staff to keep informed and make data-driven decisions while maintaining those ethical standards that are so important to our field. And then finally, as Justin alluded to, and all of our panelists alluded to, there's rapid advancements within the AI field. So making sure that we're staying up to date on those is crucially important. We don't want to be left behind. And, it seems like every day there's a new tool or a new article that's coming out, and just making sure that we're staying up to date is incredibly important. Alrighty, so this is, if you joined us a few weeks ago at our last webinar, this is a example of what a bias mitigation training session could look like. So this specifically focuses on prompt engineering. I won't go through the slide. I recommend you going back to that recording of the February 12th webinar, and Emma does a fantastic job of outlining how training staff to do this prompt engineering can really enrich and make those comprehensive outputs that are really aligned with community goals and make sure that they're inclusive and accessible. Alrighty, so the overview of provisions. Like Emma said, we did a very comprehensive policy scan, looked at many pieces of state legislation and city policies, as well as a literature review. And the main buckets that we found with training and capacity building that I'll talk about here are providing that comprehensive training. So making sure that it touches on a variety of different topics, such as ethical use, bias mitigation, human oversight, things that you see throughout our template. Additionally, ensuring ongoing education. So, being on this webinar is great. This is a great first step. You should go to many more webinars. You should go and engage in many more discussions. So, always finding those opportunities, I think, is incredibly important, and organizations, when they're able to, making sure that they're offering those opportunities to their employees. And then finally, training staff to assess and refine AI use. So again, taking that a step further and making sure that staff are, continuing with their AI use and really advancing. And then finally, we have our sample provisions. I won't go through this word for word because I know we're at time, but the three buckets that we're looking at here, or the three topics that these provisions touch on, are staff training requirements, training for public health functions, which Jamie did a great job of discussing today, what some of those public health functions are, and then finally, continuous training requirements. I think I've discussed that on every single slide, but that's how critically important it is to always evolve and make sure that we're learning as AI is continuing and advancing. So with that, I'll wrap up and transition it over back to Rebecca. Thank you so much.
Thank you so much, Shelby, and thank you to all of our presenters and our panelists today. This was an extremely engaging and valuable conversation to be having, just so much great information. So I know we're at time, and so thank you for hanging on with us for this last minute. I do have a few pieces of information to share with you. We want to make sure that you get the resources and that you also get the information for continuing education credits. So first, you'll see in the chat, we have dropped a resource guide. It's a PDF that has 2 pages, and it has a lot of links to different resources that were referenced today, discussion questions that you can use with your organization or your team, just as Shelby was talking about starting those conversations. And you'll also see that recording to that February 12th convening that was referenced today is in that reference guide or resource guide as well. So please download that from the chat and feel free to use it as you continue your journey in learning about AI. And then, of course, your feedback is extremely important to us as we continue to design events just like today. We really want to hear from you, what works for you, what formats, what topics are of interest and meaningful for you and the work that you're doing. So you also see the link to the feedback survey in the chat. We would really appreciate if you take just a couple of minutes to fill that out, and then we can use that feedback to continue delivering events such as today's. Thank you so much for joining us today for our final Bring It session. As a reminder, all of the recordings for all 5 sessions and all of the slides and resources are available on our event recap pages on our website. So please feel free to check them out if you didn't have a chance to attend previous sessions. Thank you so much for being here with us today. We hope you have a wonderful afternoon.